Hi everyone, it's Tuesday. We're back after work chats. My name is Gleb. I'm your favorite host. I know this, and it's Tuesday, which means that we're here with LK today. Hi LK.
Hey, Gleb.
Tuesdays, we're talking about news in the industry, and we're gonna split into two parts. First part, I want to talk a little bit about AI, and then second part, we're gonna bring LK in and talking about EHR systems, especially Epic, but others as well. So let's dive in. The first thing I want to cover is AI, and this is kind of following up healthcare AI, and this is kind of following up of on what we were talking before, and not with LK, with Mr. Chaudhry in one of my previous podcasts with him about AI and healthcare. That there's a lot of development in the industry, and now we were just talking about this, but now there are actual results, like proven results happening. So there's a company which is called Sanford Health, from South Dakota. They're pretty big. They have 500 clinics, around 500 locations, more than 40,000 staff, so pretty big clinic. They decided um, to unveil, basically to roll out the AI system, the which is gonna which was basically their own predictive model, which is going to predict colon cancer. And this is a model that's using not only certain, like, small number of parameters. They're saying that I'm also going to just check the numbers so I have everything right. They're using 85 variables to determine, which is analyzed by AI to determine uh, if there's a potential risk and who has to get treatment, like who has to get scanned first. And this is a major, huge improvement from, because back in the days it was just like maybe age, family history, lifestyle, like small those things. But now there are 85 variables. That's first, which is big and big improvement. But also it's been possible just because of AI is able to analyze that amounts of data. But the actual reason for this, why they started doing this, is because the U.S. Preventive Services Task Force, which is a U.S. government agency, they lowered the age for routine colon cancer screenings from 50 to 45. This change added 100,000 newly eligible patients just for them, just for that clinic, for that location. And they realize they don't have resources to do all of them, because 100,000, they don't have enough of machines to do all the screening. So they have to be more uh, picking, like choosing candidates that are more likely to be predetermined to have so they have a higher risk of colon cancer. And that's why they started testing with us, saying trying to figure out who they should scan first, who's in more risk, more danger. And but I think this is huge, because they're saying as well, they can use it all around, not only for colon cancer, start using and trying for other different diseases, but moreover, they're going to share the data that they already tested on, and they saying that they tested on 450,000 individuals ages from 45 to 80. So that's the data they tested on, the data set, and they're going to share the data set and all their findings with other clinics and allow them to use this, and probably put in more of others, like from other clinics, and make a better, even better AI platform and a learning model. And I think that's huge, not only for colon cancer, but anything else. But it's a great step forward. And I'm just happy that what we were talking before, we were just talking, but here's actual proof that it's happening in the industry. So that's covering AI basis. And now let's bring LK back in. I see his face. He's a little bit bored already with me rambling on for too long. So, bringing out LK back in, we're going to be talking about EHR software. EHR
hmm
software also, I decided, well, because LK has a lot of experience, I decided to talk about this with him. But the reason I started, like I thought about this, is that I saw an article somewhere saying that there's 8 big health systems that are switching to Epic recently. And well, and the Epic is the US leader. It has the largest share in EHR systems in the US. Yeah, again. Uh, so Epic is a big thing, but I don't really want to focus just on Epic. I just want to kind of understand the differences between the platforms. So like for us, like we know difference between, let's say, Apple software and Android software, or yeah, again, between Windows and Mac OS. Like we kind of understand the difference. Spotify and Apple Music. We understand the interface difference. But EHR is for us, like for me, I don't work with this as much as LK does on an everyday basis. So kind of that's why I decided to ask LK to get my knowledge up to speed as well. And what would you say are, first of all, let's start with this. What are the most popular systems that are used right now? There are big players in the industry.
Uh, the most popular ones right now is, you know, Epic is on number one, first
Yeah,
of all.
yeah.
We have Athena Health.
Mm-hmm.
We have eClinical Works, which is also known as ECW.
Mm-hmm.
We have Practice Fusion, and yeah, these are some big names that I know of. But yep, these are, I believe, some of the. Cario is also one of that, and yep, Cario, Practice Fusion, Epic is always on top of that, and Cerner is one of that as well.
So there are a
Yeah,
lot of them.
a
I also
lot, a
thought
lot.
there's availability, or availability is not something, is not
No, no,
EHR.
no, no, no.
That's something.
Ability is a provider portal. It's
Okay,
not an
that's different.
EMR
That's different.
EHR.
Okay, so there are a lot, and
Right.
we from my understanding, we work a lot with ECW. Is that right?
We're working with all of them. We're
All of
working
them.
with
Uh-huh.
yeah, for Practice Fusion. We're working with Epic as well. We're working with ECW, eClinical Works, and we're working with Athena as well.
And I don't want to put you on the spot, but I kind of will. Which one would you say is the best for you? Which one you like the most?
Uh, yeah, I'd say my personal preference is leaning towards Epic.
Epic.
Because it's highly adaptable,
Hmm.
integrates seamlessly with multiple, hospital system, provides a powerful analytic engine that supports, clinical decision making. Epic is also, Epic's usability basically, along with its, ability to securely share data across systems, and plus it, that the Epic has, a very user friendly interface,
Hmm.
right? And anyone can manage it, right? So and basically there are two big ones, right? Out of those two, my first favorite is Epic. The second one is Cerner,
Hmm.
and they always receive, high user rating, especially among, larger healthcare systems that need, expensive or, functionalities for small to medium sized practices. Plus, they're robust
Hmm.
support, and especially it helps in billing and scheduling a lot, a lot.
But so does it matter for, so let's say Epic, can it work? And I'm just picking Epic as an example. Can Epic work with huge corporations as well as with small clinics?
Yes,
So they are
yes.
versatile. Okay, in that sense.
Yeah, actually, all of those EMRs, EHRs out there, they are versatile, but
Okay.
some have worked a better, they have a team of developers who are working tirelessly, making it user friendly. And Epic is one of them, but it doesn't mean, Athena, ECW, or it's anything less than Epic. But, if we have to gauge them, that's my personal preference. I
Hmm.
have people in my office right now, they prefer to work on ECW, or they even prefer to work on very, a low rated EMR because they are, comfortable with that. So it's totally
Hmm.
about, a personal preference. I would not say, what, you should have, but it's about personal preference.
And you would say the biggest difference is like user interface. So in terms of like in terms of software of what it can do and how powerful the software is, they're more or less they're all identical.
Yes, it is. They're more or less all identical, but only the interface is different.
Okay. And
Mm.
so I was reading somewhere that, and maybe you don't know anything about this, but I saw that Epic is developing their own AI tool. Do you
Yes.
know anything about this? Have you started using this?
No, we have not started using it because it's in the beta phase right now,
Okay.
right? So they are testing it themselves. It's not out to the client yet. but it will be out there because everyone is doing that, and it is essential
And
nowadays.
what is it going to be used for in
Well,
the
the AI basically it will be mostly used for AI driven insights, basically,
hmm
to help identify, scheduling, some, high risk patients, right?
okay.
And streamline preventative care.
So will it affect how you work or like because you're doing mostly prior
It,
auth
it,
referrals, will it help you with
it
that
will
or
help
no?
us a lot. It will
Okay.
help us, even be more productive and better decision making. It's going to give us, some good insights. We will have the insights within the EMR now,
Okay.
but
Eh,
it's mostly going to help the clinic itself or the hospital itself.
So it's gonna okay. Okay. And you would say with AI, does it is it only Epic that started doing this or there are other you see others doing following the same path?
Of all, others are following the same path. Athena is on working on that. Practice Fusion is working on that. ECW, I think they have also started working on that. Cerner, CER, Cerner is one of that. The Epic and Cerner are basically leading,
hmm
and the rest is following.
Yeah, I just decided to check so we know what we're talking about. Epic has 39% of the US acute care hospital ma market share.
Yes,
39%,
and
that's huge numbers.
yes, and that's increasing day by day.
Yeah. So, uh, is there anything, and it's also from my just understanding, is there anything you would wish they improved it better? There's some interface, how like you don't like how it looks, how it works. Any EHR software, EHR, you mean?
Yes, good question though. Well, EMR have if EMR EHR systems they have evolved considerably,
Mm-hmm.
right? And there are always room for improvement, or there are new updates that there, and interoperability is a big one. Systems should be able to communicate seamlessly across platforms which requires because extensive customization or expensive add-ons. User experience is another area where I think or I see room for growth. By the way, often EMRs can feel, complex for us as well, right?
Mm-hmm.
And counterintuitive, leading to a longer training times and user frustration. That's something which we face on daily basis, right? Because, you know, if you cannot understand the EMR, it's a complex thing for you, right? It's a maze for you to, navigate it through. Right, so
Mm-hmm.
it should have an interface which the users and they everything is a click away from them,
Yeah.
right? So that's what I'm trying to say, that the EMR systems, the team behind it, they should work on the user interface a lot because
Okay.
everyone it should not take months to get trained someone just on an EMR,
Yeah.
right? Plus, moreover, I love to see enhanced predictive analytics, which I already told you, like
Yeah.
AI is already there, right? And it gives practices broader range of activities that they can perform on that same EMR with AI driven
Mm-hmm.
insights, right? There should be customizing, easy
Yeah.
easily
Yeah.
customizable options for everyone. Visualization tools, that's very important. Visualization tools,
Okay.
uh s- so I think that's pretty much, there's so much we can add, but of course with the
Yeah.
passage of time sometimes there's the technology is not available. But if you go back like about 5 years back, would have you ever imagined that AI will be integrated into the healthcare as well?
Yeah. Probably not yet. Yeah.
Right, because but the tech, but the technology was not there at time. People were thinking that there should be something like that, but the technology was not there. Since now the
Mm-hmm.
technology is there, that answer has been answered. Now there will be new challenges that
Yep.
people will like to get solutions for. The people like me, right, who call themselves an expert but still need the assistance in
Yeah.
in
Yeah.
so many ways. We like to get things automated. It doesn't matter in which settings you are. We are working in the settings of outsourcing. But we still need things to be automated because we need to be more efficient so we can
Mm-hmm.
perform better for our clients. And so there are tools available for us. There are tools coming for us as well. As a BPO, we can go ahead and adopt to those tools. Without those tools, we will be left behind, right? And it's a
Yeah.
marathon, right? And we if we are not fast enough, we are not, coming on the podium.
Yeah, I completely agree with you, and I kind of resonate with the same thing for the interfaces being like it's too much information that they have to put in because there's so much information. So I don't use EHR. It's yours, basically your responsibility. But for me, I use Salesforce every day. And Salesforce, I saw a joke somewhere. I don't know, it was one of the platforms, maybe on Twitter, on X. They were saying that you need a PhD to be able to navigate through Salesforce. And I
Exactly.
agree. Like when I go in the Salesforce and like I know that they can't do because there's so much information that has to be there because it's so versatile. It can uh like adapt, everybody can benefit from Salesforce. But at the same time, the amount of time I use, like especially at the beginning, to understand where what goes where, how to make this, how to put this. So I like this. It's like so hard, and it's the same kind of like I'm saying, like resonating with what you said, saying that it is you have like the interfaces too much, but at the same time, like they I think they're thinking about like making it more personalized, and maybe AI will help with this. Like at the beginning, asking like, what are you going to be using it for? Adapting it for just for me, not for like everybody who's using Salesforce or in your case, EHR software. So maybe something like this is going to happen. Something like this is going to change, but uh, for now, we're all using Salesforce, we're all using HRs, and we're just trying and learning every day how to do certain things and how to understand the interface. Okay, thank you. Thank you for your time. This is Tuesday. I'm going into the field today, talking to people, learning, listening to our clients, talking to our clients. So a lot of interesting things happening from my end, and I'm gonna be back with LK tomorrow. So tomorrow is Wednesday. We're having a live stream with our AI expert, and we're gonna be back with LK on Thursday, talking about news in the healthcare industry. Thank you, LK.
Thank you.
Everybody else, you know what to do. Like, leave us a comment, and subscribe to our channels. Have a good day. Have a good rest of your Tuesday. Bye.